Hello, I'm John McClarty. In May of 2012, Lori and I lost our son Brendan to a sudden and severe asthma attack. Brendan was diagnosed with asthma at an early age, but it never really significantly impacted his ability to play sports or enjoy life. He was never hospitalized with asthma, nor had he ever been to the ER for an attack. It became very important for us to share this story and try to prevent such a tragedy from happening again. We established the Brendan Memorial Foundation in 2017. Our mission, to honor the life of Brendan McClarty by fighting asthma through education and awareness. We had a hefty goal of getting a bill passed to allow schools to stock albuterol inhalers to administer to children in respiratory distress. Our dream became reality in April of 2019 when Governor Stitt signed Senate Bill 381, Brendan's bill, making us the 16th state across the country to pass such a bill. This video is made to show the proper way to administer inhalers. Thank you.
Hello, I'm Greg Blair. I'm an internal medicine doctor, and I'm also Brendan McClarty's uncle. The purpose of this video is to teach everyone how to use those inhalers, or to teach the people who are involved in the program how to use those inhalers properly so that we can dose medication for kids. The ultimate goal, of course, is to save a life. Asthma is the most common respiratory illness of children. It affects up to 22 million kids diagnosed with asthma every year. 1 in 10 children has a diagnosis of asthma. Unfortunately, most Americans don't take asthma all that seriously because most asthma attacks are not truly life-threatening. Unfortunately, occasionally asthma attacks can be life-threatening, and more than 3,000 people die in America every year from asthma. The other burden that asthma brings is a huge cost in days of school missed. And the more days of school that a child misses, the more likely they are to fall behind, and it decreases graduation rates. There are up to 14 million days of school missed simply due to asthma in America. Equate that to there are also 14 million days of work missed because of asthma across America. So it's a very prevalent, very serious illness. 3 in 5 kids with asthma will limit their physical activity. And one of the things that we're learning is often children limit physical activity to prevent an asthma attack. That means that they may not even know that they have asthma. They just know that when they exercise, they can't keep up with the other kids and they have trouble breathing. So a lot of that is undiagnosed asthma. One of the other big things that we know is that over 50% and up to 75% of people who actually have an asthma inhaler don't use the inhaler properly. So part of what we're going to talk about today is how to use an inhaler. Another big tragedy in America right now is that 1 in 5 kids who need an asthma inhaler cannot afford the inhaler and don't have insurance to buy the inhaler. So even if the kids are trying to take care of themselves, or if their parents are trying to take care of them properly, they cannot get the medication that they need. What's happening when we have an asthma attack? As a physician, you think of an asthma attack as the fancy term bronchoconstriction. Constriction of the airways, constriction of the bronchi. So the airways actually shrink. The pipes that we breathe through become constricted, and it makes it more difficult for air to pass. The symptom that an asthmatic has, they look like they can't get air in. Everybody looks at the person and thinks that this person's struggling to breathe. I need to help them breathe. The actual problem that an asthmatic person is having is getting air out. You have a tremendous amount of force in your body to suck air into your lungs, but blowing air out is actually a pretty passive exercise. So basically we relax and our body constricts itself and pushes air out. If our airways are tight, we can't move that air out. So in the end, an asthmatic builds up and builds up and builds up air to the point that they can't get further air into their chest. This, combined with inflammation that goes along with an asthma attack, leads to mucus production in the airways, frequently causing them to cough. And in severe asthma attacks, that mucus actually will get down in the lower airways and fill them with thick watery-like substance so that air, even if you can get it down to those airways, can't get across the membranes and get into the lungs and get into the bloodstream. Well, as a school employee, teacher, healthcare worker, what am I going to see when a kid has an asthma attack? Well, number one, you're going to see shortness of breath. And number two, wheezing. We all equate wheezing with asthma. Most people have heard wheezing. A lot of babies wheeze just when they're asleep, and it's just because they're small and the air makes a little noise when it comes out. So that wheezing is that high-pitched airway sound, and it really is produced by kind of what I just did. Forcing air through a closed-off airway makes that high-pitched sound. You can actually get such a bad asthma attack that even trying as hard as they can't move enough air to make that musical quality. That's one of the things that's a very bad sign in someone who's having an asthma attack. Now, we know about shortness of breath and we know about wheezing. Kids often will also describe chest tightness. In America, healthcare workers are taught that chest tightness is a heart attack. I'm here to tell you that chest tightness in someone under 25 years old is far, far, far more likely to be asthma than it is to be a heart attack. So the American Lung Association agrees that we should consider chest tightness in younger people like that, especially school-aged kids, much more likely to be asthma and treated as an asthma attack before we think about a heart attack. Now, of course, that comes with the caveat that kids with known underlying heart problems shouldn't be taken for granted that it's just asthma. The other common symptoms that you'll see, kind of what I alluded to before, fatigue. The kid that gets tired all the time. They walk down the hall and they're tired. They go out to recess and they can't keep up with the other kids. Most of the time, that's not just a kid who's in bad shape, who needs to exercise more. If they truly are avoiding exercise and avoiding playing with other kids because they say they get tired, it's probably because they have some underlying asthma and they can't breathe well enough to keep up. The other very common symptom in kids is cough. Kids will come in, they will sit in the classroom, and they will cough. We all remember in grade school sitting through class, and there was one kid in the class who coughed seemingly every day, or all winter long, seemed to have a cold and a cough all the time. Teachers, school staff, I'm telling you, that kid that has a cough and a cold all the time and is sick all winter long, it's asthma, even if they never wheeze and even if they never tell you that they're short of breath. Pay attention to that. Talk to that kid's parents and see if you can get them to take them to a doctor. Oftentimes, if the doctor will give them an inhaler, you can change that kid's life. Imagine going to school and feeling like you're sick every day, and then someone helping you get a medicine that you can just do a puff on before school and not having that problem the rest of your life. That would be something that allows you to learn a lot more, allows you to not get made fun of at school. You can really be, it sounds silly, but a life-changing experience for that kid. So now we kind of know some symptoms that will point us towards the diagnosis of asthma, or towards a kid who's at least having trouble breathing and may benefit from treating asthma. So the big thing is if that kid's coughing, if they're wheezing, if they're short of breath, we want to not be afraid to try to use an inhaler. And if we're going to use an inhaler, we want to use it properly. This is a fake inhaler, so don't think I'm going to be doing a whole lot of medicine, because I am going to pretend that I use this inhaler. No medicine comes out. We don't want to get in a huge hurry trying to use an inhaler. You oftentimes see on TV shows or on commercials or something where the person takes it, they shove this inhaler in their mouth and blow that inhalation into their mouth real fast, and of course, immediately within 2 seconds, they feel much better on TV. That's not what happens in real life. In real life, this thing is going to squirt medicine. The medicine comes out, and it blows out to about here. So if I have this thing in my mouth, that medicine basically hits at the back of my mouth, and it all gets absorbed into the skin there where it doesn't do a lot of good. What we want to do with an inhaled medicine is the medicine forms that cloud, that vapor, and we want it to be breathed down deeply into the lungs. And that's why anyone who has a child with asthma or has dealt with asthma lately, their provider almost always gives them a spacer of some kind. So we are providing spacers to be used with the inhalers that we provide. And it's this little cardboard, supposedly disposable disposable spacer. You'll see on the side of this that it has two little fingerprints. Those fingerprints are to show you how to open this flat cardboard and make it into a spacer. By squeezing on the fingerprints, suddenly we've turned this thing into pretty much a tube. As a tube, it can be used as a spacer. There's a big open end. We'll stick our inhaler in that open end. And now, you've probably seen something that looks kind of like this. We have an inhaler with a spacer. The greatest thing about having the inhaler spacer combination is for a young child, you don't have to necessarily time when you squeeze the trigger on the medicine and when they breathe it. Because the medicine now goes into this chamber. The chamber doesn't absorb the medicine, and you get a cloud of medicine that you actually can see through the little window. So what we do is we take the kid, and we're going to be trying to give them 2 to 4 inhalations, and we just want them to try to settle their breathing down as slow and deeply as possible. We set up our inhaler with our spacer, and then it's nice to try to time it with them breathing. So you have them put their mouth on the end here with the 2 holes. And you want them just breathing and taking deep, as slow a breath as they can. So that you can try to time, they've just breathed out. And as they breathe in, try to squeeze and ask them to take a deep breath in and hold it. Now, when we're using these chambers, it's difficult to do the timing just right. And most kids who are having an asthma attack can't take a real slow, deep breath. So instead of having them take that thing and breathe in and just hold it, we're going to ask, especially younger children, probably 10 and under or so, to try to breathe as slowly as they can, but just keep their mouth on the spacer and move that air back and forth. And in that manner, most of that medicine that's in the chamber will eventually get down into their lungs. We do that for about 20 to 30 seconds, let them breathe on it. Then, as our protocols will tell you, they're going to do 4 puffs. So you do 1 about every 30 seconds to a minute until you get those 4 puffs in. One of the advantages to doing 4 puffs and taking 4 minutes is if the medicine's going to work pretty well, typically by the time you're done giving the medicine, they will start to dilate their airways and be feeling a whole lot better. And so will you as the provider, because it's a real relief when you watch a kid go from respiratory distress to being able to breathe calmly. So that's pretty much it on how to use the spacer and the inhaler. So next, let's talk about when to use the spacer and the inhaler. And most pediatricians and most pulmonary pediatricians especially will tell you, if you're afraid that a kid's not breathing well and you're afraid that it's an asthma attack, give them the albuterol inhaler. There are very, very few contraindications to it. It can make your heart race some, but that will go away over a couple of minutes. Most kids tolerate it very well. It doesn't taste bad, it doesn't cause sore throat or any other weird things. This is not a steroid inhaler where some of those other inhalers, doctors teach people to brush their teeth afterwards. This isn't going to do anything to give them a yeast infection. This is a medicine that is a rescue medicine. If someone looks like they're in distress, you should try it. That's kind of the bottom line. Remember at school, if you're ever using this particular inhaler, you should also be thinking about calling an ambulance. If the kid doesn't look all that bad, or certainly if the child has a history of asthma and their parents know that this might happen at school, call the parents first. But if you ever have a kid who scares you, who you think may go the wrong way, who you think may help, call 911 before you do anything else. Always remember to get the professional help on their way to you before you start trying to call parents and things if you really think the kid's in trouble. So our rules of thumb is parents should be notified any time that we have to give the child our inhaler, the school's inhaler. There will be parents, I can almost guarantee, who simply don't give their child the inhaler that they need when they go to school because they don't have enough to keep one at home and one at school and things. They'll try to take advantage of the system at school. We need to be calling them if we have to use the inhaler at school and encouraging them to send their kids' inhaler with them. We also want to let parents know if a child's having symptoms near the end of the school day so that they know that the child may be at risk to have a flare when they get home. Also, that tells them that the medicine they took in the morning may be wearing off at the end of school and they need to kind of plan to give them another dose either during school or right after. If the child reports that their chest feels tight and that they really just can't breathe, we want to make sure we call the parents right away and let them know this may be a more significant asthma attack than they're used to the child having. And certainly that goes without saying if this is a child that doesn't even know they have asthma. And then the bottom line is call the parents if you're worried at all. My thought would be if a child comes to the office to tell you that they're having trouble breathing, we should call their parents. When to call an ambulance, again, that's whenever you're scared. If you think there's something about this that just doesn't look right, call an ambulance. I can promise you the ambulance drivers would much rather be heading to the school to pick up a sick kid and be called and told that they're not needed, or show up and realize that they're not needed, rather than show up and find a kid who's blue that they're having to do some of their special stuff with. So don't be afraid to call the ambulance. And also, if the kids get better, we don't have to transport them via ambulance. If a kid is having trouble walking or talking, and by that I mean they can't talk in a full sentence, they can't complete what they want to say, then that's someone who's short of breath enough that we need to be thinking about going to the emergency room, and you should probably be calling an ambulance. The other things to watch for is if a kid's lips are turning blue, that's called cyanosis. It can actually happen in the finger beds and in the lips. It happens to some people when they get cold, but if you feel like it's happening because this kid isn't breathing well enough, then that's an automatic, I need to call an ambulance because this kid is really short of breath. Your lips will not turn blue unless you're getting significantly low on oxygen. So the next slide is a pretty busy slide. Hopefully in the room you can see this pretty well. It's not as complicated a slide as it looks, and I'll encourage all of you to take a close look at this piece of paper that's included in your packet. Basically, it has a stop sign that says, if you have any concern that this is a severe asthma attack, I need to call 911. To the right of the stop sign is a box in yellow that says this kid's having mild to moderate symptoms. Well, how do I as a layperson judge mild to moderate symptoms? That's kind of, if the kid can speak in full sentences, if they tell you that they're not having any worse of an attack than they usually have, things like that, then that's considered a mild or moderate symptom. We're going to give them 4 puffs of albuterol with the spacer and see how they do. We can move down that slide to the green box if they're getting better. We stop giving them medicine, we call their parents, and we probably will even let that kid go back to class. If they don't get better after that initial treatment and they're still short of breath, again, we may have started treating them before we called their parents. So again, we're going to call their parents and we're going to give them another 4 puffs if needed. If we ever give that second 4 puffs, we need to be calling 911 to make sure that backup is on the way. Now, moving back to that stop sign, when do I call 911 for sure? Well, if I'm afraid this kid isn't doing well at all, they can't really tell me what's going on. They're giving you that, I can't breathe. I never get this bad. Kind of that acting I just did isn't good, but it's kind of that no-brainer. This kid scares me when he walks into the office. I think this kid's going to stop breathing. Well, that's an automatic call 911, And then sit down, get your spacer, get your inhaler. While you're waiting on the ambulance to get there, we're just going to give those 4 puffs and see how they do. If they do better after 4 puffs, we're going to have them sit here in the office and relax and wait for the ambulance to get there and let them check them out. If they're not getting better, then we're going to give 4 more puffs and again, reassess. Again, we're basically buying time until the ambulance gets there. There are occasionally times when you may have called 911. It may take 30 minutes or more for the ambulance to get there. You need to base further treatment on how the child is feeling. And at that point, hopefully you can talk to their parents too. A child that's got asthma to that degree, their parents probably have some experience with it and can help guide you as well. Most communities, if a school calls for an ambulance, the ambulance will be there within 10 minutes. Very rarely is it going to take them over 15 minutes. Now, if you have a kid who's not doing well and is trying to turn blue, that'll be the long, scary 15 minutes. But help will get there, and the albuterol will buy you the time to keep that kid going until they get there. Last but not least, we have a form that is our documentation log. I blanked on what we called it. There should be some in your packet, as well as we have it available on our website, the Brendan McClarty Memorial Foundation website. We'd like for you to fill it out on our website. If for some reason you cannot fill it out on the website, please fill out this piece of paper and send it in. This documents for us how often the inhalers are getting used. It documents when you might need us to help you get more inhalers. And more than anything, it allows us to keep track of some of the data so that we can see if we're making a difference for kids across the state. Our goal would be that we get every school using this and that we prove within 3 to 5 years that we're making a big difference keeping kids in school, so we're missing fewer days of school, and that we probably will be able to document that we have saved a life or two, at least, over a few years. And moving along to where all schools across the country, if we can collect this data, will start to supply asthma inhalers to treat kids in an emergency. So my last plea is to remember that stock albuterol saves lives. Also remember, we're in the middle of a pandemic. The Brendan McClarty Memorial Foundation typically does fundraisers multiple times during the year, and with that money we buy inhalers and the spacers and all these things that we supply to schools to help this program. Currently we're not able to do a whole lot of fundraising, and we are asking everyone that we touch, if you feel compelled, if your child has asthma, please go to our website, read Brendan's story, read about the wonderful things we're doing with asthma, and if you feel like you can help us out, please feel free to send us a contribution. Thank you.